Hi, good morning. My name is Serge. I'll be your student nurse practitioner for today. Can you please confirm your full name, date of birth for me, please?
Renata Yafasova, June 6, 1994.
Okay, so I just washed my hands. So today we're going to do a full head to toe examination. So I'm going to start off with your head. So I'm going to look at your face. It is equal bilaterally, no signs of redness or lesions. Can I palpate your head, please?
Sure.
I don't feel any bumps, I don't see any rashes. Your hair is fine and smooth. I don't see any hair loss, no depressions, no bumps in your head. Very good. So I'm gonna have you, I'm gonna perform a eye exam on you, okay? So I'm gonna start off with a Rosenbaum chart. So you're gonna hold this 14 inches from your head and read with your right eye, close your left eye, read the smallest line you could read.
LTFPH.
Okay, very good. Now read with your left ear. Eye.
LTFPH.
Okay, very good. Now look with both eyes and read the smallest line you could read.
LTFPH.
Very good. Vision is 20/20. Cranial nerve 2 is intact, which is good. So I'm going to continue. I'm going to do an eye test, eye exam. So I'm going to have you look up. I'm going to pull down your eyelid. Sclera is white. No jaundice, no yellow or redness is present. Cornea, no sign of abrasion in your cornea, which is good. Your lacrimal system is intact. No dryness or excessive drainage. Conjunctiva is also intact, no redness. Cornea, iris is equal bilaterally brown in color, and pupils are equal bilaterally 2 centimeters diameter both eyes. So first, I'm gonna inspect your pupils for direct and consensual pupillary reflex. So what I'm going to do is have you look straight ahead. Okay, so all right, your pupils constrict in your right eye, which is good, and consensual reflex is present in your left eye, which is good. Okay. Pupils constrict in your left eye, and your consensual reflex in your right eye is also present. Very good. So that was for direct consensual light reflex. Now I'm going to perform a test for convergence and accommodation. So you're going to look straight ahead, okay, and focus on the pen. All right, so your pupils constrict and your eyes converge on the pen, which is normal. So next I'm going to perform a test for visual fields by testing for your accommodation. How many fingers am I holding you?
2.
How many fingers?
4.
Okay, how many fingers?
1.
How many fingers?
5.
Okay, very good. So confrontation is normal, and then I'm going to have you follow in an H pattern. All right, very good. So cranial nerves 3, 4, 6 are intact, as well as cranial nerve 2, which is your visual nerve. So no nystagmus was observed. So next, I'm going to perform a fundoscopic exam. So look straight ahead for me, please. Okay, very good. Okay, perfect. So your macula is clear. There's no AV nicking present. No burst vessels. Your optic disc ratio in both eyes is 0.3, which is normal. There's no opacities present, and red reflex is present in both eyes, which is normal. So next, I'm going to inspect your nose and your sinuses. Okay, so I'm going to palpate your maxilla and frontal sinuses. Tell me if there's any tenderness.
No.
Tenderness.
No.
Any tenderness?
No.
Okay, I'm going to palpate your temporal artery. Okay, so it is 2+. I'm going to palpate. Tell me if you feel any tenderness.
No.
Tenderness?
No.
Okay. Very good. So I'm going to test for patency of your nose. So I'm going to have you close your left nostril. Breathe in, out. Okay, now close the other one. Breathe in and out. Okay, very good. Now close your eyes and close your left nostril. Okay, tell me what you smell.
Alcohol.
Okay, now close your right nostril. Tell me what you smell.
Alcohol.
Okay, very good. So I palpated. So next, what I'm going to do is I'm going to perform a speculum exam, and cranial nerve 8 was intact. So cranial nerve 1 was intact, your olfactory nerve. So you look into your nose. Your septum is straight midline, no perforations, no excessive discharge, no deviation present. And the same in your left nostril. It is midline, no perforation, deviation present, and no nasal polyps are present in both those nostrils. Very good. So next, what I'm going to do is I'm going to inspect your mouth. So I'm going to look at your lips. So your lips have no cyanosis present. There's no cracking or discoloration, no redness. You're pink and moist, which is normal. So I'm going to inspect your the inside of your mouth. So you're going to open your mouth here, please. All right. Stick your tongue out. Say Okay. Gag reflex is present, which is normal. So cranial nerve 10 is intact. Very good. So lift up your tongue for me. Very good. Teeth are intact, no missing teeth. So oral mucosa is pink, moist, no cracks, ulcers, discharge noted. Your tonsils are 2+, no exudates, no tonsil stones, no redness was present. Very good. Your palates were also pink and moist, no redness or cracks and ulcers were noticed. So next we're going to move on to the ear exam. So I'm going to perform a whisper test. So you're going to close your eyes and tell me what you hear.
1, 2, 3.
Okay.
1, 2, 3.
All right, very good. So you passed the whisper test. So that means your cranial nerve 8 is intact. So what I'm going to do next is going to perform the Weber and the Rhine test. So you're going to tell me which ear do you hear the sound the loudest in?
It's equal.
Okay, very good. You're going to tell me when you stop hearing the sound.
Stop.
Okay, do you hear the sound now? All right, tell me when you stop hearing the sound.
Stop.
Okay, do you hear the sound now? Okay, very good. So you passed the Weber and the Rhine test, so you have no signs of sensory neural or conductive hearing loss. Air conduction is greater than bone conduction, which is normal. So your ears are equal, bilateral, no signs of redness, swelling, discharge. Very good. So you palpated your mastoid process. So what I'm going to do next is I'm going to press on your tragus. So tell me if you feel any tenderness or pain.
No.
Very good. So what I'm going to do next is I'm going to perform an ear exam with the light stroke. Okay, so I'm going to pull your pinna up and back. All right, so your tympanic membrane is pearly gray, 5 o'clock cone of light, no signs of perforation, redness, or discharge. Okay, so I'm going to pull pinna up and back. Your tympanic membrane is pearly gray, cone of light is 7 o'clock, no redness, discharge, or perforation is present. Okay, very good. So next, what I'm going to do is I'm going to inspect your neck. So look straight ahead, lift up your chin for me. Okay, so trachea is in line, no deviation is present. Your thyroid is non-palpable, which is good. So next, I'm gonna palpate for your lymph nodes. So first one will be the preauricular, okay, post-auricular, occipital, okay, tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, and supraclavicular. So your lymph nodes are non-palpable, which is good. There is any tenderness at all when I palpate? Very good. No tenderness. So next, I'm going to perform the chest exam. So what I'm going to do is make sure you're properly dressed, which you are. So I'm going to check your AP diameter. So please lift up the sides of your arms to the side. All right, so your AP diameter is 1 to 2, which is normal. So next, I'm going to inspect the front of your chest. Let me take a look to see if there's any redness, lesions, swelling. All right, so nothing like that is visible, which is normal. No discolorations. So next, I'm going to check for the respiratory rate. So just breathe in and out for me normally. Okay, very good. Respiratory rate is 15, which is normal. So I'm going to inspect your posterior chest. So please just turn this way. This way, please. And take a look. Okay. No lesions, no redness, no swelling. It's visible on the posterior chest. So what I'm going to do next is I'm going to assess for tactile firmness. So please, I'm going to put my hands and say 99, please.
99.
Okay.
99. 99. 99.
Okay. So there is no felt vibrations, which is good. Does not indicate any lung consolidation. Very good. So next what I'm going to do is I'm going to continue with inspecting your posterior chest. So I'm going to percuss all fields of your posterior chest. Okay, all fields are resonant, which is normal. So what I'm going to do next is assess for diaphragmatic excursion. So you're going to breathe in, hold your breath for me, please. Okay, now breathe out and hold your breath. Okay, very good. So the difference was 4 centimeters, which is normal. All right, so next I'm going to auscultate. So I'm going to auscultate all fields of your chest, posterior chest. So breathe in and out for me. Okay. Lung sounds are clear. There is no crackles, no rails, no crackles, rails, or wheezing, which indicates that there is no issues there. So next, I'm going to perform the Goffrey test. So I'm going to auscultate again, and you're going to say E when I tell you. Say the letter E. Say E.
E.
Say E.
E. E.
E. Okay, very good. So I could barely hear that, which indicates there is no consolidation in your lungs. So next will be the pectoralic test. So you're going to whisper 1, 2, 3, and I'm going to auscultate one more time.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, very good. I could barely hear that, which also indicates that there is no consolidation in your lungs. All right. So I'm going to now inspect your anterior chest. So face towards me one more time. I'm going to palpate. Tell me if there's any tenderness.
No.
No tenderness. Okay, very good. So now I'm going to percuss all fields in your anterior chest. All right, very good. So the sound was resonant, which is normal. So next, I'm going to auscultate your anterior chest. So breathe in and out for me. Very good. Lung sounds are clear. Again, I didn't hear any rails, crackles, or wheezing, which is normal. So performed the Goffman test. So next, what I'm going to do is I'm going to assess your cardiac system. So I'm going to identify the 4 points where I'm going to listen to. So second intercostal space is the aortic. Second intercostal right side of the sternum is the aortic valve. Second intercostal left side of the sternum, that's pulmonic. Okay, fourth intercostal left side of the sternum, that's the tricuspid. And fifth right ventricular on the left, that's the mitral valve. Okay, so I'm going to auscultate with both sides of the stethoscope. Okay, aortic. All right, very good. So I could not hear any S3, S4 sounds. I heard S1, S2, and no murmurs were audible. So I have the head of the bed at 30 degrees, so you're gonna lean back. Okay, so I'm gonna assess your neck for any signs of bruise or thrills. Carotid pulse is palpable. No signs of venous, jugular venous distension present as well. Very good. I couldn't hear any thrills on your carotid artery, which is normal. So what I'm going to do next is I'm going to palpate for the point of maximum impulse, which is the fifth intercostal space, mid-clavicular line. Okay, so I felt the PMI. Okay, I'm going to also take the PMI. Okay, so calendar rhythm. All right, so pulse is 65, which is normal. All right, you can sit up for me. All right. So your pulse deficit. I'm going to calculate your pulse deficit now. I'm going to palpate your radial artery. All right, your pulse deficit is 0, which is normal. So one more time, can you lean back for me so I can also take the 4 sites while you're laying down? Okay. So second intercostal right side of sternum, that's the aortic valve. Left side. Second intercostal is melodonic. Okay. So tricuspid is fourth, left side of sternum. And mitral is fifth space, left side of sternum. Again, S1, S2 present, no S3, S4, no murmurs are present as well. Very good. So next is I'm going to move on to measure your blood pressure. So sit up for me. Blood pressure. So check your blood pressure. Blood pressure is 110/82, which is normal. Okay. So next, I'm going to examine your abdomen. So lay down for me, please, again. All right, so your abdomen, I'm going to inspect your abdomen. So it is flat, there's no redness, discharge lesions, or skin abnormalities observed. I inspected it. Next, I'm going to also take. So I'm going to also take for the upper left quadrant, upper right quadrant. Vowel sounds are present. Upper left quadrant. Vowel sounds are present. Lower left quadrant. Vowel sounds are normal, active, and present. And right lower quadrant. Sounds are or normal, active, and present as well. Okay. So next I'm going to percuss for your liver, and I'm going to measure size. Alright, so your liver is 6 centimeters in diameter, which is normal. And I'm going to check for your spleen. I'm going to percuss the upper left quadrant. Very good. I'm going to palpate for the inguinal nodes. Very good. No palpable inguinal nodes are present. So next, I'm going to check for your any kidney issues with costovertebral angle tenderness. So you're going to sit up. All right, I'm going to strike your left angle. Don't you feel any pain?
No pain.
Okay, very good. No pain. Very good. So next, I'm going to examine your musculoskeletal system. So what you're going to do is you're going to walk. I'm going to check for your gait. All right, so you're going to walk from here to there in a straight line. Okay, now walk back. Okay, gait is normal. No limping or any Parkinsonian movements are present. So you're going to sit back on the chair. Very good. So, sorry, you're gonna get off again. I'm gonna inspect your spine. All right, so you can check the back of your back. Your shoulders are midline. Can you lean forward for me? Okay. Spine is straight and curvature. No evidence of scoliosis, which is normal. So next, I'm gonna assess for any tenderness. I'm gonna palpate your spine. Do you feel any pain anywhere in your spine?
No.
No pain anywhere, okay. So I'm going to assess for range of motion of spine. So first I'm going to start with the neck. You're going to tilt your head forward and touch the chin to your chest. Now lean it back. Okay, lean side to side. Okay, very good. Then you're gonna touch your toes. Okay, you're gonna lean sideways like this. Okay, and lean backwards slightly. Okay, very good. So spine and neck, and lower back are they have full range of motion, which is normal. So just sit down again for me, please. All right. So I'm gonna inspect your muscle groups for symmetry. There's no abnormal movements present during this examination. So let me examine your legs. So knees appear symmetrical, feet appear symmetrical, your hips appear symmetrical, shoulders appear symmetrical, elbows appear symmetrical, wrists and fingers appear symmetrical. Very good. So next, I'm going to inspect and assess the range of motion of all your joints. So I just inspected for your spine and your neck. I'm going to inspect for your TMJ joint. So you're going to open your mouth and close your mouth. Okay, very good. So you're next, you're going to palpate for any tenderness. Any tenderness, any pain, anyone?
No.
Okay, very good. So next I'm going to move on to your shoulders. I'm going to palpate any tenderness.
No.
Okay, so I'm going to check for range of motion of shoulders. So you're going to stick your arms out forward. Very good. Above your head. I go behind your back and touch your shoulder with one arm. Now do the opposite. Okay, very good. So you got full rotation, extension, flexion in your shoulders. So next we're going to move on to your elbow. I'm going to palpate. Tell me if you feel any tenderness in your elbow.
No.
Okay, now extend your elbow all the way. Okay, now flex it back. Very good. Full range of motion, extension, flexion of your elbows. So next we're going to check for your wrist. So you're going to palpate any tenderness.
No.
Okay, you're going to go like this, bring it all the way back, bring it all the way forward. Okay, flexion, extension in your wrists is present. Full range of motion is present. So next I'm going to move on to your hips. You're going to lay down for me. Tell me if you feel any tenderness.
No.
Okay, very good. So what I'm going to do now is I'm going to have you lift up your leg. Okay, I'm going to lift it up. Okay. Bend your knee. I'm going to abduct. I'm going to move on to your left. Okay, lift it up. Okay. Abduct. So you have full range of motion in your hips. Very good. So next is going to be the knees. So I'm going to palpate any tenderness.
No.
Okay, very good. So you're going to extend your legs all the way forward. Now pull them back. Okay, so flexion extension is normal and full in your knees. So now let's move on to the ankles. So we're going to palpate. Any tenderness, any pain?
No.
Okay, you're going to move your foot back like that. Good. And now all the way down. So you have extension, flexion, and rotation present in your ankle. So full range of motion in your ankle. Very good. So next will be your feet. So yes, move your toes in and out like that. Very good. So you have full range of motion in your toes as well. I forgot to do your fingers. So let's do your fingers. So make a knuckle, extend it. Now move each finger up and down. Okay. Any tenderness?
No.
Okay, very good. So you have full range of motion in all of your major muscles. So next will be the mental status exam. So can you tell me what your full name is?
Renata Hospital.
Okay. Do you know where you are right now?
The hospital.
Okay. And what is today's date?
July 22nd, 2023.
Okay, so you are A&O times 3, which is good. I'm going to test for your remote memory. Who was president in 2012?
Barack Obama.
Okay, very good. What did you have for breakfast this morning?
Bagel.
Okay, very good. Speech is normal. There is no slurring of speech, which is good. So let's test your memory recall. I'm going to ask 3 words. I'm going to give you 3 words to remember. Can you repeat yellow,
Yellow.
fireplace,
Fireplace.
red?
Red.
Okay, so I'm going to ask those words in a few moments, and you're going to try to recall them. So we tested your cranial nerve one, the olfactory. We did the smell test. We tested your optic during the Rosenbaum. Can you repeat the three words that I asked you?
Yellow, fire truck, red.
Yes, very, very good. Fireplace.
Fireplace.
Okay, very good. So we did optic nerve. We did that. We did 3, 4, 6 convergence and confrontation test. We did. We didn't do we do a trigeminal nerve test. So you're going to tell me if you feel this.
Yeah.
Can you feel this?
Yes.
Very good. We're going to test your facial nerve. So you're going to lift your eyebrows up and down. You're going to puff your cheeks. You're going to smile. Very good. So next, we checked the acoustic nerve. We did the whisper test. We did the vagus nerve, the gag reflex. Okay, so next we're going to do the spinal accessory nerve. So you're going to lift up your shoulders. Okay, very good. So we just did the mental status and cranial nerve test. Hypoglossal nerve was intact during the oral exam as well. So next we're going to move on to the motor test. So we're going to test for upper extremity drift. So you're going to close your eyes, extend your hands forward, and hold it for 10 seconds. Very good. I don't see any pronator drift. So next we'll assess tone strength of each muscle group. So we're going to start with the TMJ. You're going to push up against my finger. Open your mouth again. Try to close against my finger. Very good. So shoulders lift up. Okay. Now you push up against my hands. Okay. Now push up to the side. Now pull, push down. Very good. So we're going to check for the elbow strength. So you're going to curl your arm. You're going to push. Okay. Now pull. Okay. Very good. Elbow test is good. Muscle strength is 5 out of 5. So 5 out of 5 strength in the TMJ joint, 5 out of 5 shoulders, 5 out of 5 elbows. Next we're going to move on to the wrist. So you're going to push up against my hand. 5 out of 5 strength in the wrist. Pull down. 5 out of 5 as well. Now let's check the fingers. So extend your fingers and push against my hand. Oh, okay. Very good. So 5 out of 5 strength in your fingers. Very good. So next we're going to move on to your hips. So lean back for me. So extend your legs. You're gonna push up against my legs. Okay. Equal bilaterally, 5 out of 5 in your hips. So now you're gonna push with your knees up against my hands. Very good. 5 out of 5 bilaterally. Now pull up against my hands with your knees. Okay, very good. 5 out of 5 bilaterally. Now let's check for the ankle. So you're gonna push your foot up. Okay. Now push your foot down. And now curl your toes upward. Curl your toes downward. Okay, very good. So it was 5 out of 5 bilateral strength on your toes, your ankle, and your knees and your hips. Very good. So next what we're going to do is we're going to assess for your sensory system. So we're going to do pain, touch, sharp and dull, and a vibration test. So you're going to close your eyes, okay, and tell me what kind of sensation do you feel?
Sharp.
Okay.
Dull.
Okay, and where did you feel that?
On the forehead and tension.
Okay.
Sharp.
Where did you feel that?
In my left arm.
Okay.
Sharp in my right foot.
Okay.
Right shin. Sharp in my left shin.
Okay.
Sharp in my right hand.
Very good. So next, when you do the same thing, tell me where you feel and what kind of sensation.
Soft in my left foot.
Okay, so that was a light touch on the left foot.
Light touch in my right hand.
Okay.
Light touch in my forehead. Light touch in my right foot. Light touch in my left hand.
Very good. So next will be the dull sensation. So we're gonna do the same thing.
Oh my god, left foot
And what kind of sensation?
is dull.
Okay.
Dull on my right hand. On my left hand, dull. Forehead, dull. My right foot, dull.
Okay. We're gonna do the last test.
And then my
What kind of sensation do you feel?
vibration on my forehead. Vibration on my left hand. Vibration in my right hand.
Okay.
Vibration in my left chin.
Okay.
Vibration on my right.
Oh, okay, very good. Very good. So, I'm going to assess for your deep tendon reflexes. So let's start with the bicep tendon. Okay. Okay. All right, so that was a tricep tendon. So it was present 2 plus and bilaterally. Very good. So next, we're going to test for the radiobrachial reflex. Okay. All right. So brachial radial reflex was present in both sides equal bilaterally, 2 plus. So next, we're going to check your patellar reflex. Very good. So next, I'm going to assess your Achilles tendon. Very good. And next, I'm going to assess for Babinski. So you're going to lean back for me and lay down. Okay. You have a negative Babinski, which is normal. So next, we're going to do a balance and coordination test. All right, so what you're gonna do is we're gonna do the Romberg test. So for 1 minute, you're gonna close your eyes, hands at the sides, and stand for 1 minute. All right, very good. You passed the Romberg test, so there's no evidence of any neural damage or cerebellar issues. So next, we're going to do a heel to toe gait test. So you're going to walk, touch your heel up to your toe in a straight line. Very good. Next, you're going to walk back on your toes. Okay, and then you're going to walk forwards on your heels. All right, very good. You're going to lay down for me on the bed. So next, we didn't check your arteries. So what we're going to do is I'm going to palpate for your aortic and auscultate. And then we're going to move on to the renal. Aortic. It's non-palpable, the aortic, so we're going to auscultate. All right. No bruit is present, which is normal. I'm going to palpate for renal artery. Non-palpable, I'm going to auscultate. So no bruits were heard on the left renal artery. Okay, no bruits heard on the right renal artery. So I'm gonna check your pulses, your tibial pulse. Okay, so they're equal bilaterally 2 plus. Okay, I'm gonna check your pulse over here. Equal bilaterally and 2 plus. So we're gonna do another balance coordination test. So you're gonna move your heel from the top of your shin to the bottom of your shin with this leg. Okay, now do it with the other leg. Okay, very good. So, I believe that, so, next we're going to do the, yes, so you can close your eyes. Set up, close your eyes, and touch your nose with your right hand, and not do it with the left hand. Very good. So that concludes our head to toe examination. It was a pleasure, and I hope to see you again.